Come in.
Thank you. Hello.
Hello.
My name is Isidro Ramirez. I'm your respiratory therapist. I'm coming down to say hi and do some educational training for you before you go home.
Got it.
Can I check your wristband, please?
Yes.
Thank you. Hi there. Can you please tell me what your name is?
Liberty Castillo,
And your date of birth, Liberty?
11/24/05.
It's a pleasure to meet you, Liberty. And I understand that you're going home pretty soon.
Yes.
And
yes,
you've been with us for around 6 months.
Yes.
And you were diagnosed with myasthenia gravis.
Yes, that's correct.
How are you feeling today?
Feeling good. Ready to get out of here.
Excellent. And you are her?
Yeah, I'm her brother.
Well, it's a pleasure to meet you. Are you going to be the one that's going to be at her house?
Yeah, I'm usually always there.
What I brought to the bedside for you today is a brochure that I'm going to hand out to you. And I'm also going to hand one out to your caregiver as well. And this is a brochure that we can take home and he can use for a little bit of a better understanding for what we say our NIF and vital capacity, which are two measurements that we use to measure how much strength your lungs actually have and to see how weak or how strong you are. I brought some tools with this that are going to be used, that are going to go home with you. And these are some of the tools. This is a vital capacity manometer, and this is going to be what we say a NIF manometer. Are you familiar with these from the hospital?
Yes.
These are the ones that we use. So attached to this is a little 6-inch hose, which we call corrugated tubing with a little mouthpiece at the end. And of course, some nose clips. Let me ask, what was your name again?
Julio.
Julio?
Yes.
That's going to be one of the brochures that you're going to take home, and you can use that with Liberty as a guide. And I'm going to be teaching both of y'all today how to use these manometers when you go to when you go home.
Okay.
Okay, for yourself, Liberty, and for your, more importantly, for your caregiver, here are some learning objectives that we're going to be going through today that you're going to learn about. Some of the learning objectives by the end of this teaching module today, you're going to be able to define exactly what a negative inspiratory force and a vital capacity are. You're also going to be able to demonstrate the correct steps for performing a NIF and a vital capacity maneuver. You are also going to recognize 3 warning signs of respiratory decline. And by the end of this educational session, you will be able to explain when to seek immediate medical attention. Okay, do you understand?
Yes.
Mr. Julio, do you understand?
Yes.
Thank you. Now, this form, this is ideal for your type of, for this setting upon discharge. While you are awake, you're alert, you've recovered, and your caregiver is here with you at this time, so this is an ideal setting. If we follow through the pamphlet, in the middle section here, we're going to have a description of the breathing test and the vital capacity. So your muscles, Liberty, help you breathe, okay, in and out. And in myasthenia gravis, such that you have, these muscles and nerves can become very weak, okay? Weak breathing muscles can make it very hard and difficult for you to breathe, as you know. 2 simple tests can measure these, which are called vital capacity and negative inspiratory force. So the first one that we're going to go to is a negative inspiratory force. And I'm going to go ahead and hand this over to you, and I want to show Julio, the caregiver. And this comes in pieces. I'm going to hand this to you first. That is a negative inspiratory manometer. That is made out of plastic. It can be cleaned, and it's usually single patient use. The next piece I'm going to hand you is a 6-inch corrugated tubing. It's kind of just a flex tubing that connects to the very end right there. If you could put those 2 together for me. Excellent. And the last piece is a mouthpiece. That goes in the very end of the tubing, of the blue tubing. Now, this is a simple setup that you can use at the bedside. So we're going to go over some steps of how to perform a NIF. And for the caregiver, I need you to follow along as well. So what I'm going to have you do is I'm going to have you sit straight up in bed. There you go. I can help you a little bit if you need help. So we're going to have you sit up straight in bed. Are you comfortable? Good. So following along with the brochure, so here are some simple steps. What I'm going to have you do is place the mouthpiece in your mouth. What you want to do is close your lips very tight. And you're going to breathe out first. Breathe out, breathe out, breathe out. And Julio, what we're going to do is we're going to have her suck everything in as hard as possible. Good job. There you go. You can put that down for me. Take a breath and rest. Did you understand?
Yes.
Fantastic. How was that for you?
Pretty okay?
Good. Okay, we're going to perform that one more time. Okay, Liberty, we're going to try this one more time. Okay, I'm going to have you sit up straight like you are. Please hold the device upright. Place your mouth around the mouthpiece. Get a good seal with your lips. Blow out as fast as much as you can. And suck it all in. Good job, Liberty. And put it down. Are you okay?
Yes.
Do you feel short of breath? Excellent. Do you understand, caregiver?
Yes.
Fantastic. If you look at the front of this machine right here, okay, there's a little number that your caregiver is going to be looking at.
Got it.
Okay, and looking at our brochure, the machine shows this number. The more negative this number is, means your breathing muscles are strong. The weaker the number may mean you may need a little bit more help. Okay, and that is very important for Julio, your caregiver, to understand. Now, moving on to the next apparatus, I'll take this from you. This is a vital capacity manometer, and this is what we're going to give you to take home. We are going to do the education with you, Julio, so you can do this at the bedside with her. Now, this has numbers in the very front, and we'll be explaining those. The next pieces is the other corrugated tubing, just like the NIF manometer. And of course, you have your mouthpiece. Very good. Now, for a vital capacity, what is a vital capacity? Now, this test will show you exactly how much air you can blow out after a deep breath in. Okay? So here are some of the steps that we're going to go through. What I want you to do is to take a big deep breath in without the manometer at this time, and simply blow it out. Good job. But what we're going to use now is we're going to incorporate a little bit of some nose clips. And these are some soft nose clips. And I want you to feel these. I want you to place that on the bridge of your nose. And this is going to make sure all air is going to come out through your mouth. Okay, so sitting in an upright position, I'm going to have you hold the manometer up, take a big deep breath in, put your lips around the mouthpiece, seal, and blow as hard as you can. Good job. Place it down. You may remove the nose clips. And how do you feel? Are you feeling short of breath? No. And these are some of the steps that we're going to have to do with her, and always ask afterwards if she's feeling short of breath.
Okay.
And are there any questions at this time, Julio?
No.
How about you, Liberty?
No.
Thank you. Liberty and Julio, why do these tests matter? Now, your care team, Julio, will be checking these often. Okay, almost daily, more than one time a day. They will watch your numbers change from test to test. They will look and to see if you have steady breathing, or to see if you have any kind of good signs with the numbers. Falling numbers, okay, can mean your breathing muscles are getting weaker, Liberty. This means you may need more of breathing support, and that's important to know, such as a mask or a breathing machine. Finding a drop early can help prevent a breathing emergency. Now, how can you and your caregiver help? You can make things easier, Liberty, by sitting up straight as possible. Keep a very tight seal around the mouthpiece, and give the best patient effort that you possibly can every single time. Okay. Now, on the back of this brochure is very important for your caregiver, Julio, and yourself to know. Now, some warning signs to know. Number one, are you feeling more short of breath than before? Number two, are you not able to speak in full sentences? And number three, a voice that may sound hoarse or weak. This could be a sign of respiratory dysfunction and respiratory failure. Now, after you leave this hospital, okay, you can call your doctor, or you can go to the nearest emergency room right away if your breathing suddenly becomes harder, or you cannot find or finish a sentence or speak. Now, we are going to go into a teach back right now, and we're going to have your caregiver perform these maneuvers on you while I observe.
You said this was a NIF and then
Yes.
capacity, right?
Correct.
So then, should I take it apart, or like this is fine?
Let's go ahead and take it apart and have her reassemble it and walk her through it while you describe what they are.
Okay. Well, this is the NIF
Mm-hmm.
system, and then this is the tubing,
Mm-hmm. There we go.
and this is the filter, I believe, or
The mouthpiece.
the mouthpiece. Yeah.
There we go.
There you go. So now you're gonna take a deep breath in. You're gonna blow out all your air, right? And then she's gonna take a deep breath in.
Correct. And you may refer back to the brochure if you need any kind of reassurance.
So you want to look back at it and make sure everything.
And you can walk her through it.
So
Step
you
one.
sit up as straight as you can.
Mm-hmm.
A small tube is placed at your mouth. You
Mhm.
close your lips tightly around the
Mhm.
tube. You breathe out first. Then you breathe in as hard as fast as you can. There you go.
Mm-hmm.
Was
There.
that good or another one?
That looks very good, Julio. You did a great job.
Good job.
And then now we're gonna do the vital capacity. And I'm gonna have to be checking this constantly, right, at home?
Yes, that is correct. You're going to be checking this anywhere between 3 to 4 times a day.
Okay. So then this is a vital capacity,
Mm-hmm.
I believe.
That is correct.
The tubing
To be.
and the mouthpiece.
Yes.
And then for this one, you're gonna take the deepest breath that you can.
Mm-hmm.
You blow all the air out into the tube or the mouthpiece.
Yeah.
And then we have to put this clip on your nose.
Mm-hmm.
And then it says that the machine will record how much air you blow out. So you're gonna blow out you're gonna take the deepest breath that you can, and then you're gonna blow it all out on the vital
Okay.
capacity. There you go. How was that?
That's great. And during that time, you can give her a lot of words of encouragement if you notice that those numbers are smaller numbers than normal.
Okay.
Okay, you can give her some good words of encouragement. And what are those warning signs?
The warning signs, which are also on the back of the pamphlet, are if you feel shortness of breath than normal, right?
Correct.
Okay. Not being able to speak in full sentences. Should I also look out for like slurred mouth?
That is correct.
Okay, and then a voice that sounds weak, hoarse, or slurred, or trouble swallowing. There you go. So if she has any of the warning signs, we just have to call 911.
You will seek immediate medical attention.
Yes.
Thank you. Is there anything else at this time that I can help you all with?
No, this is great. This is very good, valuable information. Thank you so much.
Thank you. Liberty and Julio, do you feel that you'll be able to go home successfully and you'll be able to perform these tests on her?
Yes.
And Liberty, do you feel comfortable with these tests being performed on you?
Yes.
Okay, now do both of y'all understand that failing numbers means that Liberty is getting weaker?
Mm-hmm.
Good. And bigger numbers means that Liberty is doing okay.
Mm-hmm.
Okay. Thank you guys for your time at this and for your efforts. Thank you.
Thank you.